want to go into, the hygienist's role, as a key player in the prevention of peri-implant disease. So we're going to go through identifying the onset of disease, treatment planning, evaluation and monitoring the implant health, home care, and referral to specialists, because these are the key ways that dental hygienists can play a role in prevention. So we talked here about inflammatory response. So we know that the tissue becomes injured when we have bacteria, or we have trauma, or we have toxins or heat. This initiates a release of damaged cells, things like histamines, bradykinins, prostaglandins, and so that inflammatory response. So it's very important that, we're doing a gingival inflammation index. So you see there, although highly controversial, current research does support probing as being beneficial. Now that we know that it's safe, the technique that we use is very important. One thing I want to mention is that you don't want to start probing right away after an implant is placed. You want to wait 6 months after restored function. So if an implant is placed and then it is allowed to heal for 3 to 6 months, then restored, then you want to wait 6 months from the day that you have the restored function on the tooth. You can see here on a natural tooth, the probe is angled into the sulcus. We walk it, along the angle of the tooth. On the implant, it's going to look a little bit different. We want the probe to be more parallel to the implant connection. We want to be sure we're using a very gentle pressure, about 20 grams. Remember that we can have a biological width violation when we're using too much pressure, which can lead to a pseudo pocket. Similar to probing a natural tooth, you want to take the 6 measurements. You want the mesial buccal, distal buccal, mesial lingual, and distal lingual. And if you get that baseline at 6 months past restored function, it's important to have the baseline, because the depth is not really as meaningful as the comparison of changes. So you can actually have a healthy implant that is probing, 5 or 6 millimeter pockets. What we really want to detect is those changes. One thing to note, that healing of the epithelial attachment is usually complete about 5 days after probing. So there might be, a little bit of loss of attachment after we probe, but know that after 5 days, it usually goes back to healing. And when it comes to probing, really, a metal or a plastic probe is completely safe. Bleeding on probing and suppuration, you want to evaluate the soft tissue margin, mobility, occlusion, and bone level. Occlusion is very important, so I encourage you to have a piece of articulating paper on your tray. You should be checking the occlusion, looking for any high spots. If you do see those there, make sure you're bringing those to the attention of the doctor, because may need to have some adjustments there. Then as far as diagnosis, or different states allow different things. So whatever we're calling it, dental hygiene diagnosis, we're going to say healthy mucositis or peri-implantitis, and then that's going to determine the type of treatment. Peri-implant mucositis versus peri-implant disease. Again, this follows very similarly to periodontal disease. On the mucositis side, we see the inflammatory response happening. We see bleeding on probing. Suppuration may be evident, but at this stage, there's no bone loss and it's still reversible, much like gingivitis. Whereas on the implantitis side, we have all the same characteristics, but this is where bone loss is present and becomes non-reversible. And that's why early detection of peri-implant disease is going to be key, just like periodontal disease.